Thank you very much, Dr. Bray. Ladies and gentlemen, I've been interested in the topic of the adverse health effects of radiofrequency radiation ever since it became clear to me from studies we did, as it happens, funded by Ontario Hydro, on workers of Ontario Hydro, and then a case control study of childhood leukemia in Toronto, where we found adverse effects when we carefully measured electrical and magnetic fields. In terms of the International Agency for Research on Cancer, I was fortunate to be present in IARC, working for a relatively short period, immediately after the International Agency for Research on Cancer reviewed radiofrequency radiation in 2011. And what they concluded at that time is that there is limited evidence in humans for the carcinogenicity of radiofrequency radiation. And what they said was positive associations have been observed between exposure to radiofrequency radiation from wireless phones and glioma and acoustic neuroma. And for cancer in experimental animals, they said there's limited evidence in experimental animals. Their overall evaluation is that radiofrequency electromagnetic fields are possibly carcinogenic to humans. That's their group 2B. Now, this sort of review is extremely important because for years, countries have taken notice of these IARC working group reviews in order to set policy on exposure of workforce or the general population to potential carcinogens. So now we have a review in 2011, and now 2019, in which a distinguished group of people brought together to review the evidence concluded there was some evidence, possibly carcinogenic. Just as a side issue, I was asked to review, before it was published, the Royal Society panel on this issue, and I was extremely disappointed. I felt they had failed to adequately address the evidence, and in my report I made this very clear, but it didn't seem to have any impact. I think we should now consider why we now believe that radiofrequency radiation causes, not just possibly causes, but does cause brain cancer in humans. There are several lines of evidence. The most important are 3 sets of case controls studies in humans. A case control study is when you identify the cases of a disease you're concerned about and comparable controls living in the population, and then you assess their exposure to the agent you are concerned in evaluating. The largest of these was a multi-country study called Interphone, and they found a 2-fold increase risk of glioma after 10 or more years of use of mobile phones. In Sweden, Dr. Lennart Haldell and his colleagues have done a series of studies. Sweden is important because mobile phones Sweden was one of the first countries where mobile phones were introduced. So people have been exposed to radiofrequency radiation from mobile phones longer in Sweden than most other countries. And Lennart Haldell has conducted many studies, several of which have shown 2 to 5-fold increased risk of glioma after prolonged use of mobile phones, especially when exposure began early in life. And then these 2 sets of studies were supplemented by a large study in France. We don't usually expect to see epidemiology studies in France, but this was a group expert in studying occupational cancer that decided to evaluate this. And they found 5-fold increased risk of glioma after 5 or more years of use of mobile phones. These studies actually also showed that the lower exposure, the less the risk. Now let's just look at some details of these. Those of you who are unused to looking at tables like this, I'm sorry, but you'll see that on the left-hand side, you'll see time from start of regular use of mobile phones. You've got the numbers of cases, controls, what we call the odds ratio, which is the measure of risk. The lowest exposure, the shortest exposure, is what we call the referent. That's 1. 2 to 4 years, 68% increase. 5 to 9 years, no more. But 10 or more years, more than double the risk. And the 95 confidence intervals on the right all show that these increased risk was statistically significant. Then we have some studies which evaluated increased risk of glioma from mobile phone exposure with 10 or more years of use. One of them was a cohort study conducted in the United Kingdom by Benson et al. This is the Million Woman study that some of you who studied the literature may know was initiated by Valerie Barral. And they didn't find any increased risk. But one of the issues there is they added a very brief question that hardly gave sufficiently detailed information. So we think there's a good deal of misclassification in this study. In contrast, you'll see the findings from Hardell with the greatest risk, 3-fold increased risk, more than 25 years of use. These are the details of that French study I mentioned. They found increasing risk with increasing exposure of glioma. They also found that the risk was greater for those who had a glioma on the same side they held the mobile phone, though this was not statistically significant, the lower 95% confidence interval being 0.7. But for meningioma, they also found an increased risk. Now, in addition to glioma, which is the most malignant form of brain tumor, many of these studies have evaluated the increased risk of acoustic neuroma. Acoustic neuromas occur on the nerve from our ear to the brain. And in this instance, the cohort study of Benson did find increased risk. Hardell found increased risk. The one that did not was a case control study in Korea. I'll come back to acoustic neuroma. The type of cell that is magnified and which causes the cancer goes by the name schwannoma. And so these are vestibular schwannomas. Then there was a study in adolescents, and one of the important things of this study, it was a multi-country study, is that they were able to collect data from operator records, not what people record. And you'll see that for those who had more than 2.8 years from the initial subscription to mobile phone use, there was a doubling of risk. In addition to brain tumors and vestibular neuromas, we have been concerned about radiofrequency radiation and brain cancer and breast cancer. There have been 7 unusual case reports. I've been trying to get people to combine to do a more definitive study. Unfortunately, it hasn't happened yet. But these reports have been supported by exposure modeling and toxicology. This was the first of these reports with invasive multiple primary tumors in a 34-year-old avid runner, a Chinese-American woman who had kept a cell phone 4 hours a day in her bra for 10 years. Here's another case. In this case, the lady had the cell phone in her bra on the outside of her right breast, and you see these multiple signs of cancer on the mammogram. There are other reasons for deducing that radiofrequency radiation causes breast cancer: exposure information, in vitro toxicology as well. Now, in addition to these cancers, in Israel particularly, they've identified cancers in the parotid or salivary gland. And these glands are where people tend to hold the cell phones. They've documented an increase in parotid gland tumors in Israel over 30 years. That's not proof, but it certainly indicates some area of concern. More concerning has been the documentation by Phillips and his colleagues that glioblastoma has been increasing in the United Kingdom substantially in the temporal and frontal lobes of the brain, the areas where you would expect maximum exposure from cell phone radiation. There have been other reported changes in rates of breast cancer from the United States. It's been reported in 2 studies that the incidence of neuroepithelial brain cancers has significantly increased in children, adolescents, and young adults from birth to 24 years. And if you're going to get an epidemic associated with cell phone use, you can expect to see the initial increases in young people, and this will gradually go through life. There have been animal studies. One of the earliest was by Lurchell in 2015, and he replicated an earlier study done in 2010 that showed that radiofrequency radiation below the exposure limits for humans could cause excess or promotion of tumor growth, tumor promotion. So there's a working together of radiofrequency radiation and other causes of cancer. More important, this year, and I'm sorry for the small print, but there's a very large study reported from the National Toxicology Program in the United States, an animal carcinogenicity study that showed unequivocal evidence of increasing cancers. In fact, the increase in cancers was largely the schwannomas I've talked about, and they turned out to be in these rats in the heart, but there was also some evidence of carcinogenic activity in terms of malignant gliomas in the brain. And this was true in 2 different forms of radiofrequency radiation. And this was supported by a lifespan carcinogenic study conducted in the Ramazzini Institute in Italy. And I won't go through the detail, but again, we're dealing with heart schwannomas and some indication of increase of malignant glial tumors at the highest exposure dose. I'm indebted for my friend Haru in McGill University, Paul Haru, who points out that 5G will increase our exposure substantially. Millions of cell towers, mini cell towers, soon to be installed every 150 meters in our neighborhoods. They will invade the privacy of every home. Optical fiber is safer, healthier, and faster. And I think my colleague Magda Havas will go into this in more detail. Several of us have written to the International Agency for Research on Cancer suggesting that the time was right to re-evaluate the evidence. And we were very pleased to learn that an IARC advisory committee has recently recommended that radiofrequency radiation should be re-reviewed by them with high priority. If they go ahead with this, they'll conduct an extensive literary search. They'll select members and a chair of the working group, and these members will be given specific tasks. They will meet in 8 days in Lyon and reach a conclusion. My own personal conclusion from reviewing all this evidence, and together with some Dr. Meg Sears and others, we have a paper in press under consideration at present documenting all this, is that radiofrequency radiation is a human and animal carcinogen, i.e. it falls in IARC Group 1. And we believe that government standards, particularly in this country, those of Health Canada, as well as Public Health Ontario, I shall have to look for my prior students in Public Health Ontario and re-educate them. We know that radiofrequency radiation is now ubiquitous. Even if the risk per individual is low, it is widely distributed and could become a major public health problem, especially if the planned introduction of 5G proceeds. Thank you for your attention.